Assalamu alaikum warahmatullahi wabarakatuh. To carry on with the lower limb lectures, I'm going to cover in this presentation the anatomy of the leg. I'm Dr. Dalia Saleh, Professor and Head of Anatomy Department at Mansoura University, Egypt. The objectives of my presentation will be: first, I'm going to revise some funny features of the skeleton of the leg and foot. And then I'm gonna talk a little bit about the deep fascia of the leg and how the deep fascia divides the leg into compartments. We have the anterior compartment, the lateral compartment, and the posterior compartment, which is further subdivided into superficial and deep group. We can see here the anterior view of both articulated tibia and fibula. In between them lies the interosseous membrane. Here is the tibial tuberosity, and this is the chin of the tibia, or the anterior border of the tibia, which divides the anterior surface of the tibia into two: the anteromedial surface and the anterolateral surface of the tibia. This is the anterior surface of the fibula. Here we can see the dorsal surface of the foot. This is the navicular bone. This bone will be the cuboid. Here is the medial cuneiform, or the first cuneiform, and the arrow here points at the distal phalanx of the fourth tooth, and here the arrow points at the base of the fifth metatarsal bone, and this is the tuberosity of the fifth metatarsal bone. Here's the calcaneus. In this view, we can see the plantar surface of the foot. We can see the navicular bone from below, and this is of course the cuboid bone. Here's the calcaneus, and this is the distal phalanx of the big toe. This is the leg. After removing the skin and the superficial fascia, you can see how the deep fascia invests around the whole leg and is thickened around the ankle joint to form what's called the retinacula. If we take a cross section in the leg like this, we're gonna see the skeleton of the leg. We have two bones. The larger one and the medial one is the tibia, and the smaller one is the fibula on its lateral side, and they are connected together by the interosseous membrane. We can also see in this cross section that the leg is surrounded by the skin and the superficial fascia, and also the deep fascia, which surrounds the leg completely except at the anteromedial surface of the tibia. From the deep fascia of the leg, there are two intermuscular septa: anterior intermuscular septum and posterior intermuscular septum. They go backward and are attached to the fibula. So the skeleton of the leg, together with the interosseous membrane and the deep fascia with both intermuscular septa, divide the leg into three compartments. We have the anterior compartment, the lateral compartment. On the back, we have the posterior compartment, which is further subdivided by a septum of deep fascia into superficial group and deep group. The deep fascia thickens in a form of bands around the ankle joint to form what's called the retinacula. The primary function of the retinacula is to keep the tendons in their place during movement of the ankle joint. We have 5 of them. We have the extensor retinacula on the front or on the anterior surface of the ankle joint, and we have 2 of them. We have the superior extensor retinaculum and also the inferior extensor retinaculum. On the lateral side of the ankle, we have the peroneal retinaculum, also divided into superior peroneal retinaculum and inferior peroneal retinaculum. While on the medial side of the ankle joint, we have the flexor retinaculum. In this diagram, you can see how the muscles of the anterior compartment attaches to both the tibia, the fibula, and the interosseous membrane. So in the anterior compartment, we have the following muscles: The tibialis anterior muscle, which is the most medial one and the biggest of them all. Lateral to it lies the extensor digitorum longus, and you can notice it by its 4 tendons that spread to the distal phalanges of the lateral 4 toes. Between them lies the extensor hallucis longus, which extends by a single tendon to the distal phalanx of the big toe, and a small muscle on the most lateral side of the front of the ankle. It's called the peroneus tertius muscle. The nerve supply of these muscles through the anterior tibial nerve, also known as deep peroneal nerve, and they take their blood supply from the anterior tibial artery. Again, in this picture, we can see the superior extensor retinaculum and the inferior extensor retinaculum. The superior extensor retinaculum stretched between the 2 lower ends of the tibia and fibula, while the inferior extensor retinaculum looks like the letter Y. Its stem attaches to the calcaneus, while its upper limb attaches to the medial malleolus of the tibia, while its lower limb attaches to the fascia on the medial side of the foot. In order to memorize how the structures pass below these 2 retinacula, we're gonna memorize it by this phrase: Tom has very nice dog and pig. T refers to the tibialis anterior. This is from medial to lateral. And then we have the extensor hallucis longus tendon. And then we have the anterior tibial vessels and the anterior tibial nerve. And then we have the 4 tendons of the extensor digitorum longus. And you can count 4 tendons, and the 5th one will be for the peroneus tertius muscle. The origin of these muscles. The tibialis anterior takes its origin from the upper part of the anterolateral surface of the tibia, and of course from the adjacent interosseous membrane, while the extensor digitorum longus from the upper 3/4 of the anterior surface of the fibula, the extensor hallucis longus from the middle of the anterior surface of the fibula, and of course from the adjacent interosseous membrane, while the peroneus tertius from the lower fourth of the anterior surface. In summary, the tibialis anterior is the only one that arises from the tibia, while the rest of the extensors from the fibula. For their insertion, the tibialis anterior, it has a tendon that is inserted into the medial surface of the first cuneiform or the medial cuneiform and the base of the first metatarsal bone, while the extensor digitorum longus splits into 4 tendons that are inserted into the dorsal surface of the middle and distal phalanges of the lateral 4 toes. Extensor hallucis longus inserts into the distal phalanx of the big toe, while the peroneus tertius into the base of the 5th metatarsal bone. So we can see here the tibialis anterior tendon. This is the extensor hallucis longus tendon, the extensor digitorum longus tendon, and finally the peroneus tertius. For the action of these muscles, they dorsiflex the foot, since they pass in front of the ankle joint, so they all dorsiflex the foot at the ankle joint. Plus, the tibialis anterior is a powerful inverter of the foot at the subtalar joint. The extensor digitorum longus also extends all joints of the lateral 4 toes, or toes from number 2 to 5. The extensor hallucis longus extends all joints of the big toes, while the peroneus tertius helps in eversion. The lateral compartment of the leg lies against the lateral surface of the fibula between the anterior and posterior intermuscular septa, and it contains 2 muscles. The superficial one is called the peroneus longus. Deep to it lies the peroneus brevis. Both of their tendons pass behind the lateral malleolus on their way to their insertion into the foot, under the cover of the superior and the inferior peroneal retinaculum. They take their nerve supply from the superficial peroneal nerve and their arterial supply from the peroneal artery, and they both share in the same action, which is plantar flexion and eversion of the foot. So for the origin of these muscles, the peroneus longus originates from the upper two-thirds of the lateral surface of the fibula, while the peroneus brevis from the lower two-thirds of the lateral surface of the fibula. The tendons pass behind the lateral malleolus of the fibula and inserts as the following. The peroneus longus into the base of the first metatarsal and medial cuneiform bones, and as you can see, its tendon cross the foot obliquely like this, so it helps in holding the arches of the foot, while the peroneus brevis inserts into the base of the fifth metatarsal bone in its tuberosity. This is the end of my presentation. Thanks for listening. If you like it, please do not forget to subscribe, like, and share. And don't forget to hit the notification bell you can see under the video in order to be notified if I upload another video.